Fibromyalgia. So many of us deal with this condition because you have chronic pain, you have been visiting multiple doctors and the doctor says it's fibromyalgia. The second question is, do we have a treatment? Yes. Now this video is for you because fibromyalgia has a treatment and fibromyalgia patients do not need to suffer lifelong. Now first let us understand what is fibromyalgia. It's a chronic pain condition mostly affecting your muscles where you have pain all over your body. Generally when we talk to our patient, they say it hurts, the entire body hurts. I can't tell you which point is hurting more and I'm in pain 24/7. Which movement exaggerates your pain, they are unable to say because it's a continuous pain which affects other system also, like you have difficulty with concentration, your performance decreases, your sleep disturbs, you have irritable bowel syndrome, sometimes constipation, sometimes diarrhea, sometimes bloating. There are menstrual irregularities. Sometimes you have different symptoms like dry eye, you have vomiting sensation. So all those things are going to make your life really difficult. Now, how do we identify that you have fibromyalgia or not? There are not much studies or criteria or tests where we will identify it properly, but the best way is to talk to your doctor. History, examination of the patient are very important. Generally, there are 11 tender points all over your body, especially in your shoulder blade muscles, trapezius, in your elbow, in your hip joint, and when these tender points are identified on both the sides, we can make a diagnosis of fibromyalgia. Also, there is a scoring system like a WPI scoring system which your doctor should actually do before diagnosing you as fibromyalgia. What's happened in fibromyalgia? The most important physiology that's happening in you is generally a normal body. If there is a stress, there are lots of hormonal changes, there are lots of neurotransmitter changes in the body, but your body is able to adapt to these changes, and so a normal person will usually not feel these kind of symptoms. But in fibromyalgia, there is a disturbance in your system where imbalance of these neurotransmitters cannot be corrected by your body, and so the body starts producing these kinds of symptoms. Now, do we need to worry? Yes, we need to worry about it because the early you diagnose yourself, the better you can be treated. So if you have any initial symptoms where you have chronic pain, chronic back pain, the upper part of the body pain, if you have tender points, if you have early morning stiffness, if you have any kind of irritable bowel syndrome, do not ignore this and see your physician so that they can initially assess you. And if you are in initial stages of fibromyalgia, then a holistic approach like lifestyle modification, then strengthening exercises for your muscles and back, some kind of medications, some supplements can help you. But if you go to a later stages like in stage 3, stage 4, where the pain has become really chronic, your body is all tender, anywhere you touch you have tender points and all your tests are negative, then also we can treat you, but it may take a little longer time. So do not miss out on getting yourself evaluated if you have continuous pain which is more than that of 3 months and associated with these symptoms. Fibromyalgia has a treatment, you can be treated, and it needs a holistic approach, and do not lose your hope if someone has told you that you have fibromyalgia.